Hello, this is Darwin. Welcome to my Learn Hub. By the way, happy Halloween. Life goes on. A post has to be made even on Halloween. Being a zombie is very difficult. There are a lot of demands for us to be walking on pretty much all types of surface, the worst kind of surface, and we don't have the best support. Sometimes we don't even have any support on our feet. We wear broken shoes and we have no sensation on our feet. So that is why it is important for us to every once in a while test our ankle, our foot, or what is going on. Maybe we can do something to improve our gait and stability, if it's possible. So the two tests that I'll be showing in my video are windlass test and squeeze test. Let's start with the windlass test. The windlass test is a test for plantar fasciitis. What is plantar fasciitis? Plantar fasciitis is basically an inflammation in the plantar fascia. Where is the plantar fascia and what does it do to the foot? The plantar fascia is a thick ligament that connects the heel and the front of the foot. It supports the arch of our feet, basically. So when this ligament gets inflamed, then you get this condition called plantar fasciitis. How do you get plantar fasciitis? What causes plantar fasciitis? Well, for one, if you're a runner and you do a lot of activities using your feet, you're always on your feet, so you could get plantar fasciitis. If you're wearing shoes that have soft sole and with poor arch support, you could get plantar fasciitis. And where do you feel how do you feel the pain? If you have plantar fasciitis, you feel the pain on the heel and you feel some stiffness. How do we solve plantar fasciitis if you test positive for it? Well, a couple of things you can do is number one, you can ice the area that is inflamed, and of course you do exercises that stretches the plantar fascia. That way you are releasing the pressure when you stretch the ligament. Basically those two things, plantar fasciitis could be solved 80% of the time, and if it's really severe, then it might be a good idea to go to a foot doctor, an ortho doctor, to take a look at the problem. Maybe you need surgery or something else. The second test that I'll be demonstrating is the squeeze test. The squeeze test is for a test for syndesmotic sprain. The term syndesmotic refers to the high ankle ligament, and if you have a syndesmotic sprain, it's also called a high ankle sprain. So it refers basically to the two ligaments that connects the tibia and the fibula, and they're called AITFL and PITFL. AITFL stands for anterior interior tibiofibular ligament, and the PITFL stands for posterior interior tibiofibular ligament. How do you get syndesmotic sprain? It is common among people who are into impact sports. So that's when you get syndesmotic sprain. And what are the ways you can treat the syndesmotic sprain? If you have the sprain and no broken bones, basically you can do icing, resting, and elevating the foot. Plus add to it, you know, wrapping with a bandage. So you do it on a routine basis, and usually the treatment could last for the span of 6 weeks until you're fully healed. And one way I've read, one way of testing if your foot is free of sprain is if you can hop on that foot for 15 times. If you don't feel any pain, then you're good. So let's watch the video, and happy Halloween. Hi, I'm Darwin and welcome to my Learn Hub for week 8 in PTA 214 L Clinical Assessment Lab. I will be demonstrating 2 tests. So the first test is called the WINDLASS test. The WINDLASS test is an assessment for plantar fasciitis, and it's done in several positions. One position is with a non-weight bearing position, and the second position is with a weight bearing position. For the sake of this test, I'm going to be performing it in the non-weight bearing position. So I'm going to have Johnny help me demonstrate this test. I'm going to have her seated on the edge of the bed with her knee flexed at 90 degrees. Stay put, Johnny. Okay, thank you. And then the technique is to stabilize the ankle in neutral position, and after that we put her in a dorsiflexion, the foot, and then followed by the toe. While she's in this position, I'm going to apply pressure with the tip of my finger on the medial longitudinal arch right here, and observe if she will feel some kind of pain. Janae, are you in kind of pain? Do you feel any pain? No. No. So that means a negative. A positive test with pain right here on the would mean that she feels some kind of pain on the medial longitudinal arch. So I did it on the left side. I'm going to do the same test on the right side. So again, put the foot knee flexed at 90 degrees, and then put the ankle in neutral, stabilize the ankle in neutral position. Go in dorsiflexion plus the toe, and then apply pressure with the tip of your finger on the medial longitudinal arch. Feel anything, Janae? Mm-hmm. Pain? Okay, so that means she's positive for plantar fasciitis on the right foot. Hello, this is my second video, and I will be demonstrating a test which is called the squeeze test. The squeeze test is an assessment for syndesmotic sprain. The position for this test could either be what we call in a Captain Morgan's position, where I would ask the patient to put the foot up on a stool in this position, and then we can form the test squeezing the leg. But for Janae's case, I'm going to have her in a prone position. So Janae, I'm going to ask you to lay in bed, stomach down. Once the patient is in the prone position, the next step is to place the hands in the proper place. So we are going to be putting our hands on the proximal tibiofibular region of the leg, and we're going to compress the tibio and the fibula together, starting from here, from the proximal region, going distal, progressing down to the ankle. And as we inch down, we are gonna compress the tibio and the fibula. And what we're trying to observe here is some kind of pain that a patient would feel in this area. So let me repeat it again. We're gonna start at the proximal portion of the leg, compressing the tibia and the fibula, together. Going down. Janae, do you have any kind of pain?
No.
No? Okay, so Janae is testing negative for this test. A positive test would be, let's say for example, I start squeezing as high up here, and the patient would feel some kind of pain right here. So the farther I am from the ankle, that means the pain is, the patient has a severe sprain. And then I'm going to do it on the other side. So proximal again, tibiofibula. I'm going to compress and then inch down, keeping the compression down to the ankle until the patient complains of pain. So since she's not complaining of pain, so I'm going to keep going down until I reach the ankle. And that is the squeeze test. Thank you.